have a good handful of people here, so let's start. And I just want to say thank you so much, everyone, for taking time out of your Tuesday night to join me for this Biointegrative Health Center International webinar. The center is located in Reno, Nevada, which is why I was a little messed up on the time zones, so I'm sorry about that. I'm located in Minnesota. I just volunteer for the center virtually, which has been really fun. So I'm excited that we can do this all together. A few things before we start. I just want to say that this will be recorded and it will be posted on YouTube. So if you don't want your voice to be shared or your name to be shared, put your questions in the Q&A box. Second, there is a poll at the end of this. It is solely to provide feedback for me and let the center know kind of what you're interested in the future. And lastly, we will add everyone to future webinar notifications via email. If you are not interested in those, that is totally fine. Please just click unsubscribe. And I'm just going to make sure that we have everyone still. Okay, finally, I have allowed everyone to talk as the host, so please feel free at any time to just unmute and ask a question if it's really relevant. Otherwise, we will have time for questions and answers at the end. So let's get to it. So March is National Nutrition Month, and though food is my favorite topic and nutrition, I didn't feel that it's right to kind of not talk about food in the social context, specifically food as a social determinant. So for those of you who don't know me, I'm Kelli Hirt. I am a certified health education specialist. I am also getting my master's degree in public health at the University of Minnesota. I'll be graduating in May, so I'm almost done. And just, really relevant to tonight's topic, I'm also a social determinants of health intern right now and absolutely love it. Social determinants of health is one of my biggest passion areas, so I'm really excited to be talking about it. Before we start, I just want to lay groundwork with a goal, because I think that this is a huge topic and I could do a series of webinars each week for a year on it. But my goal for tonight is just really to help you understand the link between food and health outcomes at a system level. A lot of you on here, I am so happy to see you, and it's also maybe a little bit preaching to the choir, so hopefully I can get a new fact in there, but thank you for being here. So to reach that goal, here's what we're going to cover. We're going to talk about important terms that we should know when talking about social determinants of health. We're going to talk about what the social determinants of health mean. We're going to talk about hunger in America and how that kind of ties into the topic tonight. And finally, we are just going to talk about food as a social determinant. So before we dive in, let's talk about some terms that we all should know to be on the same page tonight. The first is hunger, and hunger is the personal physical sensation of discomfort from a lack of food. Everyone experiences this. A lot of times we say someone is experiencing hunger when they are in fact food insecure, but just know that everyone experiences this. This is solely the physiological function of needing food. Food access is the accessibility to affordable, healthy food sources, and this is measured by distance to or the number of stores in an area. Transportation, family income all play into this. Food insecurity is a lack of consistent access to enough food for an active, healthy lifestyle. Next, the last three terms that I want to talk about are food desert, and I have food apartheid in parentheses here because a food desert is it kind of has a negative connotation, and a lot of people in the social determinants of health, food justice world like to use the words food apartheid to sort of describe this, and this is where This is areas where individuals have low access to healthy food and a variety of those food choices. The apartheid just kind of speaks to the structural reason that there is not enough food in that area. There's not enough food choices. So just a clarification there. Health equity is the absence of unfair and avoidable or remedial differences in health among populations defined socially, economically, demographically, or geographically. Basically, unfair, not meeting people with what they need, making sure that everyone has something that suits them and can serve them to be healthier. And finally, just want to talk about systematic or institutional racism. This is a form of racism that is embedded in laws, policies, and practices of society. The social determinants of health are basically material or tangible thoughts that are that have systemic racism all throughout them. And that is one of the reasons that they need to be addressed. So let's dive in. Now that we have those terms, that was a lot of me reading off the slide. I will not do that the rest of the night. So thank you for bearing with me. Social determinants of health. Let's talk about what creates health. Health is defined or created, 70% of health outcomes are tied to external factors. So that means that things outside of an individual's control inform people's health. So if we look into this box here, in this box, we see that there's physical environment, that's 10%. That's sort of, the climate, the conditions and where our houses are, what's the air quality, what's the water like. Social and economic factors, this is where a lot of the social determinants of health lie. These are education, employment, income, things like that. And then there's clinical care. In this sense, it's access to care and it's the quality of care that people are accessing. So these make up 70% of health outcomes. That means that 30% of the health outcomes that we see are individual. And this is where America places a lot of the responsibility for health outcomes. We say that, the responsibility is on the individual. We need to educate the individual to make a healthier choice. Very true, but a lot of times that individual doesn't have choices, and that's why we need to be talking about the social determinants of health. So finally, we are here at what are the social determinants of health? Social determinants of health are things that make up an individual's environment, where they live, work, and play. They are non-medical factors that affect health and health outcomes. They are very systematic, meaning that no one individual can change them or influence them. Of course, collectively, we can all do something about it, but they are driven by money and power, like our local, state, and federal leaders, corporate leaders, things like that, and also resources. So like what do communities have that sort of informs these? So the social determinants of health are so broad, and I could list, I think, probably like 1,000, but for the sake of tonight's webinar, we're going to talk about the social determinants of health in terms of these 5 categories. And these are from the Healthy People 2030 objectives. So they really contain just about every social determinant of health we can think of. So these are education, access, and quality, healthcare and quality, neighborhood and built environment, social and community context, and economic stability. So I am going to walk through each one of these and talk about food within that. And while I will be talking about structural racism in most of these, I do just want to acknowledge that structural racism and health inequities are caused by by these things and lack of supports in these categories. So just a heads up where we're going with this. And just to reiterate, our environment determines our health. So let's learn more about that. Food as a social determinant. I want to start this section with kind of why it matters. And I've used this slide in other webinars that I've done, just because I think it's really important to kind of know why we're talking about this. And currently 50 million people, including 17 million children, face food insecurity. That's 1 in 4 children, by the way. And then I want to point out that food insecurity affects different communities disproportionately, meaning that people from communities of color, minority communities, underrepresented communities have higher rates of food insecurity, and they have a higher risk of being food insecure. So I just want to point out that Black individuals have a food insecurity rate 2 times that of non-Hispanic white people. This is something that is 100% created by the social determinants of health. And this relates because America has more than enough food to feed everyone comfortably. So we need to do something. We need to get this food to people, and we need to get the right food to the right people. And addressing social determinants of health can reduce this number and increase overall health. One more sort of overview before we dive into those 5 categories. I just want to note that food insecurity is an extremely complex problem. Not one thing is going to solve it. And that is why the social determinants of health, all working together, can play into reducing food insecurity and hopefully one day eradicating it. So primary drivers of food insecurity are unemployment, poverty, low assets. Food insecurity can also cause these things. If someone is not able to eat, they are probably going to be more sick. If someone's more sick and has to miss work, they may lose their job. So it can be sort of a vicious cycle. Also over here, it says needs don't exist in isolation. And a lot of times when it comes to food, people have to decide between buying food and paying for their medications. They have to decide between buying food and paying rent. This is not at all optimal for health, and we need to do better. And we can do that by talking about and addressing social determinants of health as a system, as a country, and in our everyday jobs. So let's start with education. Food and education go hand in hand. Children who are malnourished may not be able to perform well, and early childhood education and development are truly key to healthy lives. We learn habits when we're young. We learn how to eat. We learn how to eat, what and how to eat, and it really does inform how we choose and how we make choices as we grow. This is really important because a lot of children, as we saw, 1 in 4 children are facing food insecurity. They rely on school meals for their nutrition. And a lot of kids truly get 2 meals a day from school. So it is really important that school meals are balanced. They are modeling healthy behavior. And then with that, we need to make sure that nutrition education is happening in schools. This doesn't mean all the time, teaching kids about how to form a healthy plate. It could literally just be using carrots and some other fruit to do math, put 3 out there. I mean, we all have done basic math and could see where just the visualization of those fruits and vegetables and seeing that every day can reinforce that healthy behavior. But yes, we also need to teach children and empower them to be able to create a balanced meal, to identify foods that are good, to read food labels. But that needs to be a curriculum thing. We also know that food insecurity affects the ability to learn. This is not just kids, it's adults, it's everyone. But I really focused on kids in this section because I think, like I said, this stage of development is really important in setting the tone for the rest of our life. So kids who are hungry have a hard time concentrating, which means less ability to learn. I know when I was a kid and lunchtime was coming, I zoned out. I didn't care what was happening. Imagine being food insecure and having that concern all the time. There's just no way that they're going to learn as well as they could if they were nourished and had the energy to go throughout their day. This is also a really important time for learning social skills, to build relationships. And if a child is healthy or hungry, they're going to struggle with that because their brain is not working as fast because it's hungry, it needs energy. So just knowing that this is really just setting the stage for a healthy future. I also want to say that this is super important in terms of employment in the future because education status will also determine employment later on in life. And as we saw, one of the key factors of food insecurity is unemployment. So now we're going to talk about the healthcare access and quality and food within that. So I think that healthcare systems have a really unique position to address food insecurity and increase food access. Just a quick little fun fact on why this is such an important part of social determinants of health. America spends more money on healthcare than any other developed country in the world. We have a shorter life expectancy, higher rates of obesity, and worse health outcomes overall. So we're spending a lot of money in healthcare, but we're seeing worse health outcomes. That doesn't make sense from a human rights standpoint or a financial standpoint. So what can we do to better that? We need to integrate social determinants of health into the healthcare system. And a lot of systems are doing this. So it's kind of really exciting to sort of see this shift and see insurance companies moving towards covering social needs like food, housing, transportation to appointments, things like that. I digress. So food insecurity is linked to these preventable diseases that shorten our life expectancy, that give us worse health outcomes. And these are diseases like hypertension, arthritis, and diabetes. Food insecurity impacts all of these, and it drives up healthcare costs. So the annual healthcare costs for people who are food insecure are $1,800 more than a person who is food secure. That is a lot of money. That is a lot of money. And it's all unnecessary. I shouldn't say all. Most of it is unnecessary costs. So just to note, access to healthy foods has been proven, it's been researched, it's been shown to reduce average healthcare costs, hospital admissions and readmissions, medication adherence. People are not choosing between food and their medication, so people will be able to take their medication more regularly, and also emergency room use. I worked at a hospital out in Nevada, and I was building a prescription food pantry while I was out there, and it was an amazing project. It was so fun, but one thing that always sticks out to me is that the manager of care coordination said, you know, a lot of people come to the emergency room for food. It's not necessarily something that they're in crazy pain. They are hungry and they know that they will get a meal. So why don't we prevent that high cost emergency room visit and make sure that that person has the means to get food, whether that's money, access to food, all of the above. The healthcare system can absolutely address these. And we see that by looking over in this corner. Places that are addressing food or social determinants of health have a 2-question food insecurity screen. And from that, they can refer to food banks, they can host a food distribution program or connect to food subsidy programs, financial help programs. But they can also take it a step further. They can build on-site prescription food pantries, meaning a person can get a prescription and leave with healthy food that day. They can do mobile food distribution for those. Again, that's getting rid of the transportation barrier. And then they can also do emergency food bags. So if someone is leaving the hospital, all of a sudden, a care coordinator or a nurse is able to grab a bag of food just to hold people over for a couple days to make sure that they aren't readmitted into the hospital. So just some really cool things that can happen within the healthcare system and community to close the gaps between food insecurity and high healthcare costs. So next we'll talk about food and the built environment. Again, I just want to acknowledge that this is a huge, huge topic and I'm just skimming over these. So thank you so much for just hanging in there. I could talk about this forever, but let's just focus on food and the built environment right now. So urban, rural, and low-income neighborhoods may have less access to full-service grocery stores. And a lot of times in these areas or in food apartheid areas, convenience stores and fast food chains are extremely common. They are what mostly makes up the food landscape. Those are the options people have. Something really interesting to note is that fast food and junk food companies specifically target these areas with their advertising. So these companies disproportionately target Black communities, Latinx communities, and low-income communities in general. And what they do is, have more advertising when SNAP benefits are reloaded at the beginning of the month or at the end of the month, whenever someone's are loaded. They advertise more in these convenience stores and they advertise more of the junk food, the like chips and sodas and things like that. So it's a psychological thing that these huge corporations are doing to make a profit off of, someone needing food, someone not having too many choices. So you can see how it gets really hard for someone to make a healthy choice when this is happening. And finally, neighborhoods with limited transportation and longer distance to grocery stores have higher rates of food insecurity. That's because, people are physically not able to get to these places and they have less food choices and the healthier foods are more expensive. So it's just an unfair disadvantage from the get-go. Next, we'll move on to the fourth category, which is social context in the community. So we'll talk about food in the community. Community is built through food and culture. People express themselves through food. This is where cultures are able to, really dive into their traditions. Even, having dinner with your family is a great way to build up a better relationship or a more strong culture within your immediate family. And it's really important that we make sure that people have access to the foods that are culturally relevant. In other words, they are familiar to those people, they're familiar to those cultures. And we need to do that by including these communities in decisions that can reinforce that supply of food. So what that means is communities who are in these food apartheid areas, they need to be involved in deciding what grocery stores come in. If there's, some civil planning going on, urban planning going on, because you're not going to put a Whole Foods in a low income community. It's going to be a smack in the face to that community and they are going to feel not heard. like their needs really aren't important. And then community gardens. If you're going to put a community garden in a place, you need to make sure, one, that the foods you are going to plant are chosen by that community so that they can be used. They need to be culturally relevant, again, meaning they're familiar to a certain culture. And I say this, I specifically bring up community gardens because I spent a lot of time in community and school gardens and like, let's build a school garden, let's do this, it's going to solve a problem. And while yes, it does work in many ways to help get people access to food and connect people to where their food comes from, it is not the only answer to solving food insecurity in these communities. We need to build better infrastructure around food. And we can have a community garden if that's what people want. So how would you do this? Think about any job that you've had or any job you're in, and just remember that the community should be the ones driving those really important decisions. So you can do that by knocking on doors, getting names of leaders in the community, and then helping them to build a core group of decision makers. And you are just there to facilitate that and make it easy for them to go through the process of getting the grocery store that works for them, planting the foods in the garden, advocating for more for their community to local and state decision makers. So just making sure that they are at the center of that decision making is really important. And then one last thing I want to talk about in this section is the USDA nutrition guidelines. They are often referred to in, a registered dietitian is going to walk you through, like, here's what the USDA says. They're updated every 5 or 10 years. Don't quote me on that, but I think it's 5 to 10. But they're great guidelines in one way, but they do not represent America's diversity. And that's what makes it really hard for people to relate to it. So communities of color, their food preferences, their cultural foods are not represented in that. And we're basically telling them, hey, assimilate yourselves, work your way into this American traditional food culture. So we need to be really aware of that, because that is absolutely going to decide if someone's going to make a healthier choice, because if they cannot relate to the food that they are educated on, there's no way that they're going to make a better choice. So just something to keep in mind. And I absolutely love this idea. This is from a Blue Zones publication, and it points out that maybe we should be having a food pyramid. Now it's, a food plate for each ethnic group in America. And that could be, we have like the African Heritage Diet Pyramid, Asian Diet Pyramid, and it's a food pyramid made up specifically of foods that are relevant to that culture. For example, tubers are one of the building blocks of the African Heritage Diet, and that is extremely relevant to the African diet, whereas someone in Asia, they have more greens and cabbage down here. I'm sorry, this is really small. But you see there's so many differences, but still so many options for healthy food. With this, we also need to make sure that we are helping people understand how to make those foods a little healthier. And by we, I mean, the medical system, health educators, nutrition educators. But again, just making sure that the food is culturally relevant, because if those are an option, people will go with what they know. And of course, all of these are only doable if a person has economic stability. So let's talk about food and economic stability. There are food assistance programs that can help reduce food insecurity. Supplemental Nutrition Assistance Program, otherwise known as food stamps, gives money to people who qualify for food. Women, infants, and children, same thing. And then the National School Lunch Program is the school lunch program, where a lot of kids get their only meals during the day. And I do just want to, share a personal anecdote here because I think it's really important. These have been proven to reduce food insecurity. They are not perfect. There are a lot of problems with them, but they help and they do mostly good. Yes, things need to be changed, but it's what we have and we need to improve upon them. But I grew up in rural Wisconsin. I grew up with a garden. I am absolutely so blessed for what I had as a child and still have. My parents live there. I started working at age 15, and at age 22, I moved to Reno, Nevada to do AmeriCorps VISTA and was a government employee. And I had to sign up for SNAP. And for me, this was so out of my comfort zone. It was crazy. But I had to learn how to, continue to eat healthy, eat like I was at home. I had to learn if that was doable on the SNAP program. And for a lot of people, they don't have that background. And they come from a place where this has been their whole life. I was fortunate enough to come from a really privileged place, and see SNAP through the lens of, wow, how can we use this as a foundation and just improve it so that people don't feel stigma when they're going to swipe their card and think, I hope I have enough money to buy this. Or you go to a place and swipe your card and don't feel shamed for using your EBT card there. So a little digression, but I just think it's really important to think about that as well, stigma in terms of economic stability and social determinants of health, because it can absolutely hinder or help people getting the social needs met that they have or need. And again, these programs are they make it easier for families to afford food, takes a little bit of stress off. Again, they're not perfect, but they take a little bit of stress off having to pay for that food. That money can be saved up. It can go elsewhere. It's really there to help people get a leg up and help work their way out of poverty. And there's a lot of financial or business people that would argue, I don't know why we're doing this. I don't know why we're giving money to these people. And I think it is just very clear that a healthier person is a more productive person. We want people to be healthy. We want people to be in the workforce. We need people to be in the workforce. So, helping people here in economic stability, helping them sign up for these programs, making sure that their environments are ready for those programs to be successful, it leads to a more productive workforce, and essentially it leads to a more productive economy. And that is something that I don't think anyone can argue with. So that was a little passion outburst right there. But I just want to talk about some main takeaways from tonight. First of all, food insecurity is insanely complex and it has harmful impacts on health. It's something that we really need to address more than we are. Our environments often dictate our food options and therefore they dictate our health. A person can't make a healthy choice if they don't have that choice available. So what can we do as a country, as a society, to help give options and help make that choice easy? Oh, sorry. And then I just challenge everyone to think about their jobs, their everyday thoughts, and you know, this is just an example, but if you're looking at poverty and poor health, don't ask, why won't this person eat better? Try thinking about it like, what does this person's food environment look like? What do they have access to? Are they able to make the decision to eat better? Because sometimes the answer is no. And then finally, again, social determinants of health are born out of power and money. And we have leaders who are elected by us. So we need to encourage our elected officials at the local, state, federal, and also corporation leaders, I would say. We vote for them with our money, really. So ask them to include people from these communities in their decision making to make sure that people have everything that they need to be healthy, and to feel safe in those environments to make healthy choices. And I'll just leave you with this. This is something that I have said for a while, and I just think it's just so relevant. Where there's healthy food, there's a healthy gut. Where there's a healthy gut, there's a healthy mind. Where there's a healthy mind, anything is possible. So that's it for the content of tonight. Again, I know that was really heavy and it was a lot of me just going through it. So I very much appreciate you hanging in there. I hope you all learned something. I'll take questions now. You all are unmuted, or you have the option to be unmuted. So does anyone have any questions?